Hello, very good morning to all of you. Today we are going to discuss the case note of Mr. Jeremy Taylor. Mr. Jeremy Taylor, a 54-year-old patient. He has been under your care in the oncology ward at Clare Medical College Hospital, Brisbane. Now, let's go with the task. Mr. Jeremy Taylor is a 54-year-old patient with in the oncology ward of a hospital in which you are a charge nurse. You are the charge nurse. He is transferring from Brooksbank back to New Abbey. So he's moving back to New Abbey. Here, when you look at the case, New Abbey is the place where actually his residence is. Right now in Brooksbank, he came to visit his daughter. By the time he got some discomfort, and that's why he sought the medical attention. So Mr. Taylor's home residence, the real residence, is in New Abbey. So he came to visit his daughter. At that time, he visited the hospital too, due to some complaints. Now, you use the information in the case note to provide a treatment summary and follow-up care plan. So you can use the information in the case notes and to provide the oncologist, you are going to write with the treatment summary what you have done, because he visited you at Brooksbank. What treatment you gave, brief it. And the follow-up care plan. He might require follow-up. So what he requires as the follow-up care. So I need two things to be written in the letter. You need to say the treatment. We need to brief the treatment which you gave to Mr. Taylor, and you need to say the requirement, the follow-up requirement. Need to address your letter to oncologist Dr. Gerald Jones, 24 Sophia Avenue, New Abbey. So this is what the thing is. So let us go ahead and see the case. Just a minute. Mr. Jeremy Taylor, whose date of birth is 19 October 1964. He got admitted on 5th of March 2018. The treating doctor is Dr. Meena Singh, moving to Dr. Gerald Jones. So only Gerald Jones is important there. So let's go ahead with the social background. He works as a banker, marital status, wife, dead. Daughter, Julie, Brad, both have not married. Stressful life, works around 15 hours a day, quite long. No exercise, takeaway food, social drinker, smokes 10 cigarettes a day. It started at the age of 16, previously tried nicotine patches, electric cigarettes unsuccessfully. So from this social background, I am not going to write something very relevant from this social background, except the smoking. So I don't want his profession, it's not that important. Marital status, not important. How many children he has, not important. What type of life he's, no, it's not important. Now I can say something about his smoking if you want, because that's something relevant there. The medical history, diagnosed with hypertension, but was not compliant with the medication. No family history of cancer. So hypertension is something which is there because he has had hypertension from 2010. So this is something which has to, because we in the coming notes we can see that ramipril is commenced for this particular thing, that is hypertension. Now we have to focus, our turn comes, and that's the treatment summary which we have to focus from this area to this area. This is what we called treatment summary. So what treatment you gave at Brooks Bank, how he was presented, what investigations you have done, what procedure you have done, and what follow-up therapies or adjuvant therapies you have initiated. Now we have 4 segments here. How he presented, brief it. He presented with infection and rust-colored sputum. What investigations, CT scans and other investigations revealed the tumor. What procedure you have done? It's what's procedure. And one more thing is there, we commenced on ramipril. So I'm selecting the main points because I'm going to summarize these things. I don't want every particular data and sequence it accordingly. The letter will become bigger and bigger. So I just want to, as to in the writing task, they asked me to give treatment summary. So the summary of the treatment. So I have the date 5, I have to select something very relevant. I have the date 10, I have to select something from there, very relevant. 15, I have to go ahead with the main points there. 17, I have one thing here, discharge, it was on 17. So if you are not including discharge date, it's not, no problem. But you can say the chemotherapy was done only after the discharge. No problem. So this is called briefing. I briefed from 5 to 17. And something I have not briefed. I cannot brief this point because the oncologist needs this thing. This is something which is very particular to the oncologist, that the adjuvant therapy which you gave from 20th of March to 20th of May 2018. And this is very specific to the oncologist. And this has to be included. I cannot brief it. I can brief from this point to this point, but I cannot brief this thing. I have to say the medicines. Yes. I have to say the weight loss, everything. Because during chemotherapy, he lost the weight. So I have got the treatment summary, and I have identified some matter is very relevant to the oncologist. I need to focus that. Now, the second part of my letter should include the discharge plan, the follow-up care, what he requires, follow-up care. Now we have something. Needs referral to a dietitian to gain 5 kgs lost during chemo. So this is a discharge plan, and this has not to be intimated to the oncologist. The oncologist is not going to deal with this thing. The oncologist is not going to refer to the dietitian. The dietitian has to be referred by you. So he has weight loss after the discharge. You had around 2 months. This is the discharge date. The discharge plan starts now. We have already referred to the dietitian because during the chemotherapy, he lost 5 kg. So a dietitian is intimated. Now a psychotherapist, again, he has several unsuccessful attempts to quit smoking. And he smokes around 10 cigarettes a day. So this is to be done by you again, not the oncologist. You have to encourage him to do mild exercise, all these things. So what you have to do, what the oncologist has to do here, the oncologist has to monitor CBC for 2 months. The next CT scan after 3 months thereafter annually, next test raise thrice per year. Continue ramipril for hypertension that we have started after the post-operative period. So medication, his test, CT scan, X-ray, complete blood count, monitoring, plus medication. The oncologist, the duty of the oncologist here in the discharge plan, we have to be very selective. The oncologist is not going to refer Mr. Taylor to the dietitian. The oncologist is not going to refer to the psychotherapist for helping him to quit smoking. But you can say regular mild exercise, which we need to begin in 2 weeks. I don't find that thing too important there. You can include that because if you're writing on 20th of May, in 2 weeks, we can start mild exercise. So oncologist, you can start. If you can say, no problem. But actually, he is going to deal with the medications and the tests. Now, daughter and son to take turns living with father and new update. So sometimes daughter will be coming, sometimes son will be coming, and this has no relevance to the oncologist. We don't need that. Okay. Now, his condition weak and pain, weak from pain, but recovering well from side effects. You can include. Okay. Now let's go ahead with the letter. It's 20 May. That's today, the last date we have, 20 May. Dr. Gerald Jones, the oncologist, New Abbey. Dear Dr. Jones, Jeremy Taylor, I'm writing to transfer Mr. Jeremy Taylor, who underwent a successful video-assisted thoracoscopic surgery for the removal of stage 2 non-cell left lung cancer. He requires your follow-up care since he's moving back to New Abbey. That's it. we have a little bit lengthy purpose, but it's just because of that what's, please understand, video assisted thoracoscopic surgery. So this I have not mentioned it as short form, so I have expanded it, and that made the problem there. So why the purpose is looking bigger? It's because of that full form, video assisted thoracoscopic surgery. So he underwent this procedure for the removal of the cancer. I am writing to transfer this patient who has underwent the removal of this thing. So the tumor is removed already, successfully removed already. Tumor is removed from Jeremy Taylor. Procedure, what's procedure? I am writing to transfer this client to you. What he requires? He requires follow-up care, because he is moving back to New Bay. Right now, he is in Brooksbank. Now, let's go ahead with the treatment summary. We have 2 paragraphs here. Mr. Taylor initially presented to us with a respiratory infection with rust-colored, with a respiratory infection and rust-colored sputum on 5th of this month. On 5th of this month, he came. Subsequent investigation, you have amoxicillin for 5 days and all. We are not going to include that because we are going to brief the history. So subsequent investigations, after 5 days, we have gone with the investigation. Subsequent investigations and a CT scan confirmed his diagnosis, for which he underwent the aforementioned procedure. So what confirmed his diagnosis? CT scan and subsequent investigations confirm his diagnosis. Post-operatively, he was commenced on Ramipril 5 mg for hypertension. So he had hypertension. So post-operatively, he was commenced on. So we have given information about hypertension here. In the history, we can say that patient is having hypertension since 2010. But I need to say that medicine is there for hypertension. I'm not telling. So when he had this hypertension, so if I want to say, I can say, but I have to write another, I have to write the matter in another paragraph. But the message I need to convey to the oncologist that he is on Ramipril 5 mg right now. It's ongoing and it started after the surgery. This is what we need to inform. It is informed already. And if you want to inform that it's he had hypertension, he has had hypertension since 2010, you have to present it in a different paragraph. So the matter is already there. I don't think that you need to include when it started. Now, 3 days after his surgery, or 3 days after his discharge, so post-operatively, all these things. So he was discharged 3 days after his discharge on 20th of this month. 4 cycles of adjuvant chemotherapy was performed. Okay, so we do have a confusion there. 3 days after his discharge on 17th of this month. 17th of this month. 2 days after his discharge on 17th of this month. His discharge was on 17th. 4 cycles of adjuvant chemotherapy were performed with cisplatin, docetaxel to prevent any relapse. So these are the medications which we use for the chemotherapy. Injection filgrastim was also given to treat borderline leukopenia. So these are the therapies after the surgery, chemotherapy with these things, filgrastim, to treat borderline leukopenia. During this period, he lost 5 kg weight, for which a dietitian's referral is sought. So we have in the discharge plan, he needs to get referred to a dietitian. For what he has to, he has lost 5 kg weight here, so that he was referred to a dietitian. So it's sought already as per the discharge plan, because it's after discharge, dietitian's referral is sought already. And the second matter, the next matter, we don't need to go ahead with the background history, where he lives, what he does, how many children he has. It's nothing relevant to this particular person. So what we have to do is that we need to focus on one particular thing, that's about his habit of smoking. So he has made several unsuccessful attempts to quit smoking. And so a psychotherapist is due to assist him in this process. So a psychotherapist is due, it's arranged. A psychotherapist is arranged, and he will be helping him to quit smoking. So this is what we need to inform oncologist. So we have intimated the oncologist that a dietitian is already informed, a psychotherapist is already informed. We have started the medication ramipril for hypertension. So these things we informed already to the oncologist. That was all. These three things are there in the discharge plan. Please note. It would be appreciated if you could continue Mr. Taylor's follow-up management, including medication compliance. So if you could continue the follow-up care, so it would be if you could, I go with provide, it is good. If you could provide Mr. Taylor it would be appreciated if you could provide Mr. Taylor follow-up management, including medication compliance. That's about the ramipril, and we have, if you have any medication going on, you have to go ahead with that. Kindly monitor his complete blood count once a week for 2 months. So that's what we have to focus on. Please be aware that he has a follow-up CT scan in 3 months. You need to give focus. Okay, bring his attention. Bring Dr. John's attention towards a particular thing. He has it, his CT scan in 3 months. Just in 3 months, he has his CT scan. And after that, yearly ones, every year one. Because he is going to stay in New Abbey again. He's going to stay with his own home with his son and daughter. So actually, it will be a long-term care, and this person will be there in the New Abbey. The oncologist, Jeremy, what's his name? Gerald Jones will be their doctor. So after 3 months, in 3 months, he has the first CT scan and yearly ones. And one more thing is there. Of note, he has 3 schedules of chest X-ray per year. So per year, he has 3 chest X-rays. So all things are intimated. Now, I have the medication ramipril, I have already mentioned. Psychotherapist, I have already mentioned. Dietitian, I have already mentioned. So the letter is complete. That's the presentation. Still, we have to look at from the beginning. The only problem here is that the purpose is looking a little bit bigger. It's because of Video assisted thoracoscopic surgery. That's it. This is the problem there. So just go with what's, it would have been shorter. And one more thing. Now I have added a successful video assisted. So what about his progress? I am not adding a particular sentence there. After his post-operative period. So after his surgery, how his condition is. We have not mentioned in the following paragraph, but we have said here in the purpose itself, he had a successful video assisted surgery. So it means he has good progress. So his condition is good, well and good. So that's why we have used the word successful there, or else we have to use this thing somewhere here. His post-operative progress was uneventful, or it was good or something. So instead of doing that, we have said it's successful. The video assisted thoracoscopic surgery was successful. We have added there. So that is the only problem. It's looking little bit bigger just because of this particular thing. So, but we have not said that he has been diagnosed with a stage 2 non small cell. We have said what happened actually right now. The current update is given, that is the surgery is done, the cancer is removed, and he is in that stage. We're not telling that he has been diagnosed with this cancer. The cancer is removed, and that is the current condition here. Thank you. And that's the end of this explanation. Have a nice day.